I have a quick question here from Mike. What do you recommend if you're employed in the US and in Canada now as a Canadian citizen working remotely if you need healthcare and need to go to the doctor and your company has no insurance in Canada? Uh, yeah, Mike, that is a great question because that question comes up all the time. So, as it is in the situation you're one of probably, I think the number, I wouldn't say it's dozens or hundreds, it's probably thousands of Canadians who said, when the question came up of returning home, they looked at their small apartment in San Francisco or New York and said, not this. I can just go all the way back home to Vancouver, Toronto, Halifax, and take my laptop with me. Problem is, you have a US offer letter, you are employed in the US, your US company is has a US healthcare plan. When you return home to Canada, you're invisible to the CRA. You are not a Canadian taxpayer anymore. You are, if you're in Ontario, you don't have OHIP. If whatever province you're in, you are no longer paying taxes. Therefore, legally, you're not entitled to any healthcare in Canada. So in that scenario, there is one, not call it an out, but one way that might help temporarily is if your US healthcare plan had traveler insurance, you have to check with your US HR person to say, what is the coverage of my plan if I am outside of Canada? A lot of plans are going to be like, there's none. They're covering you in the US state where you're registered, maybe out of state, probably not out of country. So one of the scenario we have basically is transfer your employment to Canada. So what Syndesis is we're a remote employer in Canada. We have 90 people working for us in Canada, all working for US companies. So the structure we have basically is the US company approaches us and says, we have a Canadian, they're working in Canada, they need to be an employer, they need to have Canadian HR, they have to be legal according to Canadian rights, we want them paying Canadian taxes, we want them to have everything that a US employee would have, except they're in Canada, and that person wasn't expecting to come to the US. So we've been doing this business for 6 years. With the pandemic, what COVID's done is it sent a lot of Canadians home. So the scenario, what we're proposing is we would approach your US company and say, you have a Canadian worker, they went home, that's where their family is, that's where they're from, home is not their apartment locally here in the US. It was probably the right thing for them to do, except now they're without health care. And now they're in a situation where not only do they not have healthcare during a pandemic, they also are not paying taxes in their country, so they can't get healthcare in their country. So we propose to the US employer is use Syndesis remote employment temporarily, maybe for 3 months, 6 months, 7 months from right now, so maybe starting January 1st until next June, July, August. Pick your favorite day when the vaccination rates are high enough and you look and say, hey, the US got their act together, it's safe to go back. Now I want to return back to that cool job I had. So what we would do is we'd have a conversation with your employer and we would propose, here's how remote employment works. We become the employer of record in Canada. We have 90 plus people working in Canada. The worker in the US, their relationship ends. So in theory, the US company would terminate you on the 31st of December. We would create an exactly parallel offer letter from Syndesis, a Canadian corporation. It mirrors exactly what you have now. You start in Canada on this new approach, January 1st. We collect and remit all taxes to CRA. So you're now paying your provincial health tax. You are paying all employer taxes starting the day, and you're holding a Syndesis offer letter. If you were sitting next to a Canadian lawyer and you showed it to them, they'd say, it's a legal offer letter. Syndesis is a Canadian corporation. All your Canadian rights are protected. If your US client was on the phone, their HR person would look at this and say, hey, we don't operate in Canada, but we're looking at looks like a legal compliant offer letter for Canada. This allows us to employ you in Canada for some short period of time. Could be 2 or 3 months, could be 6 months, could be a year. Hey, this gets you health care. We care about you as an employee. You're covered in Canada. That scenario should cover you. You have a follow-up question, Mike. So basically you're asking, will travel insurance also work if your company has that in Canada, if you need to go to a doctor? So the only way the travel insurance would work either you have that policy with your current company as part of your US healthcare, or I guess you could buy travel insurance to cover you during the contingency of when you're in Canada. So you're basically saying you're buying it from the US perspective, saying I'm in Canada traveling. Again, you'd want to be really clear, like what's covered. Are you covered for anything that happens, that could go wrong during the pandemic? The other question is going to be like, where do you fit for vaccinations? If you're on a travel insurance plan and you're not signed into provincial healthcare, then how are things going to work for you when they start doing vaccinations and you're sitting there in Canada? What's basically happened is when you left Canada, according to you, Canadian tax officials and healthcare officials, you're invisible. You're not paying taxes. You have no right to anything. So the question you want to ask yourself is, do you want to be in that situation? Is it the best thing to do? And if your company was listening, would they say, hey, that's okay? What we're hearing HR people doing is, though in the US, is they would freak out a little bit. They're like, wait, we want to take care of you. You're our employee. If you're in Canada, yeah, Mark's right. You're not paying taxes in Canada. You're not covered. You're not part of the Canadian healthcare system. Maybe this approach of having a employer of record is the best way to go until you come back to our office here, which can be, again, summer or fall. So the travel insurance angle, it might partially cover you. You still have a Canadian tax exposure. So on the webinar we had a couple of weeks back, we had a cross-border tax specialist out in Toronto. One thing she was noting on the call was, okay, healthcare is scary enough, not having that, not paying at a provincial level. By the way, it's not quite legal to be working in Canada for a US company, and the CRA has no knowledge of it. They actually have to be notified of it. There are tax treaties, but this gets complicated. And that's why I've had multiple calls with cross-border tax people the last few weeks. All of them, when share the situation of Canadians returning home, their response is, this is a nightmare from a tax perspective. The easier thing to do is to temporarily terminate your employment in the US, use an employer of record like Syndesis for the time of Canada. You're going to get a T4, all your taxes are collected and remitted to the CRA. CRA's happy, they're paid. Why pay the American taxes? You're not there. Then when it's time to go back to the US, you got your TN visa, easily renewable for when you come back. Put your US offer back in play, come back to the US, terminate the agreement with Canada. You've basically killed two birds with one stone. You've covered your healthcare situation, you're paying at a provincial level, and you've also paid the CRA what's owed. You're in Canada, living in Canada, working in Canada, even though it's remote. You've taken care of both of those. It's the best solution just for what's happening during the pandemic. It's obviously been a disaster in multiple ways. It's totally understandable why you went back to Canada. This remote employment option may be a good one for you. Mike, is that answering the concerns you have?